Hello and welcome to Dead Doctors Don't Lie. Dr. Joel Wallach, your host, a veterinarian and physician. And I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative. A lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, if you have a health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free at 1-888-379-2552. And that's toll-free, 1-888-379-2552. Well, let's see here. We spend, as America, as a country, more money for health care each year than all the other 218 nations of the world put together. Yet, since 1990, we've dropped from 17th in longevity, which is one way of looking at the scorecard, down to 50th. So we've gone from 17th to 50th, doing what the doctors have told us to do. The rate of heart disease, cancer, Alzheimer's disease, obesity, things like ADD, ADHD, autism are all going up. Heart disease going up, cancer is going up. So what's the problem? Well, the problem is doctors go after symptoms as opposed to getting to the root cause of the problem, and they don't even know what the basic root cause of the problem is. Now, I can say that with great cynicism because we've known the cause of these diseases for 50, 100, 300, sometimes 1,000 years. And medical doctors, since the very beginning, have always treated symptoms as opposed to getting to the basic root cause. Let's take cancer, for instance. One of these things they've said forever is, eat lots of fiber to reduce your risk of colon cancer. Well, in 1998, the Harvard Nurses Health Study came out. They looked at 90,000 nurses, 50,000 male doctors over a period of 20 years, 140,000 people who were professionals who took fiber and didn't take fiber, whatever. When they compared those who took fiber and those who didn't, there was absolutely no difference in the rate of colon cancer. Well, there's one of those lies. And then they said, listen, a low-fat diet will reduce your risk of cancer. Well, they looked at people who had high-fat diets versus those who had low-fat diets. There's no difference in the risk of colon cancer, breast cancer, and prostate cancer, regardless of how much fat you take in. Then, on the other hand, they looked at supplementing with vitamins and minerals. We've known since 1912 you can reduce the risk of breast cancer by, 82% by supplementing with 200 micrograms of selenium. You reduce the risk of prostate cancer by 69% by supplementing with 200 micrograms of selenium. You can reduce the risk of colon and rectal cancer by 64% by taking in 200 micrograms of selenium every day. You can reduce your risk of lung cancer, whether you smoke or not, by 39% by taking in 200 micrograms of selenium every day. That gets better than that. If you cook your food very well done, if you cook your meat very well done, compared with, say, rare or medium, you increase your risk of breast cancer and colon cancer and prostate cancer by 462%. You can increase your risk of breast, colon, and prostate cancer by 462% simply by overcooking your food because the fats in the meat and eggs and whatever turn into what's called heterocyclic amines, which are some of the most egregious chemicals ever, right? And then we also know that you can reduce your risk of colon cancer by 75%. This is, again, the Harvard Nurses Health Study. And they only ran this on 15 years. It was so good. You reduce your risk of colon cancer by 75% by taking a heavy-duty mega multiple, such as, as an example, you could use the Mighty 90. The Mighty 90 can, according to this one study by Harvard Medical School, says you can reduce the risk of colon cancer by 75%. So, what if you take your Mighty 90? You supplement with extra selenium by 200 micrograms, and then you cook your meat medium or medium rare, and guess what? The odds of you getting cancer is reduced by anywhere from 82% to 462%. This is not difficult. These are things we have in control. Then let's look at a study that was published by Harvard Medical School where they looked at county-by-county longevity and causes of death. They found out that the cancer, heart attack, stroke, and diabetes belt is in the old 13 Confederate states and the adjacent states and Indian reservations compared with the people who live in the Midwest and the Upper Plains states. So what's the difference? Everybody has equal access to medical care and pharmacies and insurance. The only difference is how they cook. The people in the old Confederate states, the adjacent states, and the Indian reservations cook everything by frying. The people in the Midwest and the Upper Plains states cook most things by actually roasting, stewing, and baking, thus eliminating the trans fatty acids, heterocyclic amines, and acrylamides. So how you cook has an enormous impact on whether or not you get cancer. And so this is something we can all do. This is something we can all do. I urge you to get a hold of the book Immortality and the CD, the matching CD, From Here to Immortality. I urge you to get the book Black Gene Lies, because it's said by the medical community, whether they're black doctors or white doctors, that cancer in black people is genetic, cancer in white people is genetic. That's a lie. And so we put it all in this book, Black Gene Lies, and there is a CD, a matching CD that goes along with it, Black Gene Lies. And then you want to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and become a student of this. And the people you love, yourself, your neighbors, your workmates, your church mates, your neighbors, you do these things, you can significantly reduce the risk of cancer, actually increase people's quality of life and their healthfulness, add many healthful years to their life, save them a gob of money, eliminated a lot of unnecessary misery. We're talking about the cost of $3 to $5 a day, depending on body weight. And I can pay you, if you become a Youngevity associate, it's a one-time fee of $10, we'll pay you obscene amount of money. This is not difficult. But the doctors are doing an awful job. They're failing us terribly, so we got to do it ourselves. We'll be back with Dead Doctors Don't Lie for these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach today, do have some open lines. Call us on the priority line at 831-685-1080. That's 831-685-1080. Lines open.
Hi everyone, Phyllis Anderson here to announce the anti-diet. No more struggle figuring out what to eat. I've found the ultimate meal replacement by Youngevity. Yes, real food is the best, but fixing high-quality meals can be a challenge. What's a body to do for a good meal? This is what I do. Make wonderful shakes, drinks, even pudding with chocolate and vanilla protein powder by Nature's Way. Plus protein shake mix and bars from Suzanne Summers. And Ultimate Youth with 46 fruits and vegetables. Tastes like pumpkin spice. Attention older folks, bodybuilders, and those who need more healthy calories. Have you tried those nutritional drinks for seniors? Please read the label. When the top ingredients are sugar, sweetener, and oil, are those calories really good for you? Why not drink something delicious and nutritious? Get your pen and paper now to ensure you're getting the best nutrition.
To find out more, call your local Youngevity distributor today.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity. We do have lines open. Give us a call toll-free at 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And one of the reasons that these top 20 longevity cultures that are featured in Dr. Milan's my book, Immortality, live so long and have 40 times the 100-year-olds we do, they have less chronic diseases, which take years off your life. And one of the ways they do this, one of the 25 reasons we found, they take in 20 times to 50 times the ORAC points, oxygen radical absorption capacity. These are measurements of how many free radicals are neutralized by the antioxidants in a food. So we have the Cocogivity has 3,000 ORAC points per ounce of this liquid dark chocolate. We have Triple Treat chocolate. It has 16,936 ORAC points per piece, the size of a pat of butter. And then we have Cell Shield RTQ, which has 15,800 ORAC points per 2 capsules, but it also has 294 glasses of red wine worth of the resveratrol for 2 capsules. I take 6 of those capsules a day. I'm getting the amount of resveratrol that you find in 900 glasses of red wine. I'm protecting myself as much as I can. I want you to do that too. Contact your Youngevity associate. Okay, let's see here. Doug, what pearls of wisdom do you have for us today?
Well, recall we've had a few studies out, had one recently where they found that men 80 and up were still getting a lot of these PSA screening tests for prostate cancer, and it's becoming increasingly evident that these are somewhat unwarranted. I have a Fox News story here where the headline is 20-year study finds prostate cancer the test doesn't cut death risk. And in this Swedish study, they looked at over 9,000 men, and they found that there's no difference in the rate of prostate cancer deaths between men who are periodically screened and those who weren't. So yet another one of these tests that is unwarranted and just an extra expenditure of money, according to one of the researchers on this study, Malcolm Mason. He's a prostate cancer expert at the Cancer Research Institute in the UK. He's quoted as saying, "There is no escaping the fact that we need a better tool to detect prostate cancers that are actually needing treatment as opposed to innocent ones that do not." And of course, there's plenty of studies out there to show that the guys who go ahead and buy into this, they get more biopsies, they get more of these other types of procedures done to them that can do all kinds of things. One of the least of which is leaving them impotent at times. So, once again, you've been talking about this for quite a while, so hence you've been vindicated once again.
Well, thank you, Doug. And of course, this goes to the truth that prostate cancer does not kill anybody. Prostate cancer doesn't kill anybody. The only thing that kills you when you have prostate cancer is the treatment. We've known this for a long time. I've dealt with many, many people who had, quote, terminal prostate cancer 20 years ago, and we just put them on a good nutrition program, a good supplement program, changed their diet, and they're still alive today. In fact, tending bar in Colorado, and in Antlers, Colorado. Let me tell you, the test, for instance, CAT scans are a way of diagnosing cancer, but they say that CAT scans have 400 times the amount of radiation, 400% more radiation than they said it did. So it actually causes more breast cancer than by not doing anything. You can do a better job just by self-examination. We also know that colonoscopic examination does not prevent colon cancer. They advertise the American Cancer Society, and I think they took that ad off of TV because everybody was outraged by it. They said if you get a colonoscopic exam, you can prevent colon cancer. That is an absolute 1,000% lie, because you cannot prevent colon cancer with a colonoscopic exam. It's very dangerous, or risk of punctures. You can catch it early enough, maybe. You can do your own occult blood test. So you can get that thing from the pharmacy for about $3 without a prescription. Do it yourself, much more accurate, no risk of death. And all these tests that are in themselves dangerous, really, I really thank you for sharing this with people, because I've been screaming about this literally for 33 years, since 1978. It's one of the reasons why I started helping people directly instead of trying to get doctors to change their ways. They're making so much money on these tests, they couldn't care about the outcome. They were just interested in the income. Well, back to you.
And we're close to break time here. If you'd like to talk to Dr. Wallach today, give us a call at 831-685-1080 or toll free at 888-379-2552. You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. We'll be right back.